Hi, guys. Welcome back for our daily practice questions. It is day 47, and as always, y'all know I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 60-year-old male presents with chest pain and shortness of breath. On exam, you hear a systolic murmur that is clearly audible with the stethoscope placed lightly on the chest. The murmur has a moderate intensity and does not radiate to other areas. There is no associated thrill. Based on the findings, what is the most likely grade of this murmur? Is it A, grade 1 of 6, B, grade 2 of 6, C, grade 3 of 6, or D, grade 4 of 6? Take a moment and tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is truly being asked of you, right? So here, the stem of the question states, based on the findings, what is the most likely grade of this murmur? So this is telling you everything you need to know, right? That we are simply trying to grade this murmur, right? So let's run it back and see what's going on. This 60-year-old male comes in, chest pain, shortness of breath. On exam, we hear a systolic murmur and it's clearly audible with the stethoscope placed lightly on the chest. Remember how with each level that I explained to you how it can vary based off the stethoscope, right? It also says the murmur has a moderate intensity and does not radiate, and there's no associated thrill. All right, so we know it must be A, B, or C because the thrill is first noted in a grade 4 of 6 murmur, right? So they said there's no thrill. All right, so we can eliminate D. Then we want to talk about the stethoscope is placed lightly on the chest. You know, with a grade 1, we need to place it firmly on the chest, right? Because it's so faint. Then it says the murmur is placed lightly on the chest and there's moderate intensity. The best answer is B, grade 2 of 6, okay? Question number 2. A 75-year-old female with a history of hypertension presents with a new onset murmur. On auscultation, you hear a loud, harsh, systolic murmur that radiates to the carotid arteries. There is a palpable thrill. The patient reports increasing fatigue and exertional dyspnea. What is the most likely diagnosis for this patient based on the murmur characteristics? Is it A, mitral stenosis, B, aortic stenosis, C, pulmonary regurg, or D, tricuspid regurgitation? Take a moment and tell me what you got in the comments, y'all. All right, so stem the question here. What is the most likely diagnosis for this patient based on the murmur characteristics? So we're diagnosing the murmur on this one, right? So just like I tell y'all with any other diagnosis style question, you got to run it back and look at those assessment findings. So we have a 75-year-old female with a history of hypertension and a new onset murmur. On auscultation, you hear a loud, harsh, systolic murmur that radiates to the carotid arteries. All right, right here. I tell you what, two things when we are trying to diagnose a murmur to pay attention to in any exam question. One, determine whether it's systolic versus diastolic, right? So it tells us here systolic. So we know systolic murmurs are mitral regurgitation and aortic stenosis. We can also have the MVP, right? So we know just to keep that in mind for now, right? Then the second thing I always tell y'all is location. So think of aortic versus mitral in those locations, right? So it says it radiates to the Remember what I told y'all. Systolic murmurs are the only ones that radiate, right? But the aortic location, because it's at the second intercostal space at the base of the heart, right? It radiates up to the carotid arteries to the neck, right? Imagine the location, right? Whereas mitral, as the location, is at the fifth intercostal space, right? It's lower down. So it radiates to the axilla. So telling you that it radiates to the carotid lets you know it's aortic. So now you want to go back to the systolic style murmurs are your mitral regurgitation and your aortic stenosis, right? So your best answer is B, aortic stenosis. All right, and question number 3. A 68-year-old male presents with complaints of leg pain that worsens when walking and is relieved by rest. On physical exam, you observe a cool, pale right leg with weak pulses in the lower extremities. There is no significant swelling or varicosities. The patient denies any leg swelling or heaviness. What is the most likely diagnosis for this patient based on these findings? Is it A, PAD, B, CVI, C, DVT, or D, lymphedema? Take a moment and tell me what you got, y'all. All right. So similar question here. What is the most likely diagnosis for the patient based on these findings? All right, when we're looking for a diagnosis, we got to run it back and look at the assessment findings. So with the assessment findings, we see that we have a 68-year-old male who presents with complaints of leg pain that worsens when walking and is relieved by rest. Again, this is that classic claudication when it's in any exertion and utilization of those lower extremities as the blood flow is needing to increase because there is a deficit in that blood flow in the lower extremities. You will have that claudication, that achiness, that pain, right? And when you rest, of course, because you're not causing this force here, the pain is relieved. On exam, it's cool. The extremities are cool to touch. The right leg is pale with weak pulses. Y'all, this is a classic presentation of PAD, right? Peripheral artery disease, right? Also here, to help you rule out CVI also, the patient denies any leg swelling or heaviness. Those are classic for CVI. So this confirms your diagnosis of peripheral arterial disease. A is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, as always, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number 1 at gmail.com. All of the things that I do offer are linked in the bio of this channel, including the website. So if you are looking to utilize any of my resources, just click the link in the bio. You'll see everything and it'll direct you to those pages. And if you're looking to book any of my one-on-one sessions or any of my custom packages or plans, as always, I tell y'all guys to either call, text, or email me, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.